All right, so welcome everybody once again. And today we are going to see about the second part of the urinary system. So, yesterday we have seen the kidney, ureter, urinary bladder. Okay, so today we will be seeing the next part, which is the urethra. Okay, so the urethra, it's different in male and females. Okay, so we have seen that in yesterday's session that the urethra in male is longer compared to that of the urethra in a female. Okay, look at that spelling, urethra. It is different from ureter. Ureter is the one which connects kidney and urinary bladder. Urethra is from the urinary bladder to the outside, okay, to the external urethral meatus. Okay, so the urethra in males, so what are the functions and what are the differences? In males, urethra is the common pathway both for urine and semen. Okay, so both the urine and the semen will be passing through the urethra. It's approximately 20 centimeters in length and is and can be divided into three parts: prostatic urethra, membranous urethra, and penile urethra. So three parts. Okay, prostatic, membranous, and penile urethra. So here you can see this is the urinary bladder. This is the trigone of the urinary bladder. So yesterday's session we have seen it. The trigone is located between the two ureter and internal urethral meatus. Okay, these are the ureteric openings and the internal urethral meatus. This is the bladder neck, and from here this part is the urethra. Okay, so the urethra has got three parts. One is passing through the prostate gland. This is the prostate gland. So it is passing through the prostate gland. So this is called as prostatic urethra. Okay, prostatic urethra. The second part, this one, a small portion, okay, it is called as membranous urethra. And the third part, it's a long one and it passes through the penis, and this is called as penile urethra. Okay, so these are the three different parts of the male urethra. Now let's see each one of these parts in detail. Okay, so the prostatic part of the urethra, it will be passing through the prostate gland. Okay, so you can see below the bladder there is a prostate gland. Okay, just below the internal urethral meatus there is a prostate gland, okay, in the bladder neck. Okay, so the urethra passes through the prostate gland, and this part of the urethra is called as a prostatic urethra. It is the most widest and dilatable part of the urethra. Okay, sometimes they will pass tube through the urethra, okay, which is called as cystoscope or sometimes catheter. Okay, in case of any obstruction or after the surgery where the patient will not be able to pass urine, so they will be passing a catheter. So when you are passing the catheter, since it is the most widest and dilatable part of the urethra, it will be easy to pass through this portion. Okay, the prostatic urethra. The catheter goes easily through the prostatic urethra. The second part of the urethra, which is called as the membranous urethra, okay, this one. Okay, you can see it is the narrowest, shortest, okay, and the narrowest portion of the urethra. Okay, so this portion, this is called the membranous part of the urethra. Okay, and it passes through the membrane which is called as perineal membrane. Okay, so that's why this is called as membranous urethra. Okay, so there is one, you can see a blue colored line. Okay, so that is a perineal membrane. Okay, so this is the superficial and deep perineal membranes. So it passes between through this perineal membrane. So this is the membranous part of the urethra. Okay, membranous part of the urethra. Okay, it is the shortest part of the urethra and it is the narrowest part of the urethra. Okay, so what does the narrowest mean? it will be difficult to pass through this part of the urethra. Okay, so suppose if you are passing a catheter, okay, it will be difficult to pass through the membranous urethra. Okay, so it is the narrowest part of the entire urethra. Okay, after you pass through this membranous urethra, you enter into prostatic urethra where it is easy to pass. Okay, so the membranous urethra is the shortest as well as the narrowest part of the male urethra. All right. The third part of the urethra is called as the penile urethra. Okay, the penile urethra, it passes through a structure which is called as corpus spongiosum. Okay, corpus spongiosum, and it opens through the external urethral meatus. Okay, I will show you in the picture. So here you can see all the three parts of the urethra. This is the prostatic urethra, this is the membranous urethra, and this long one is the penile urethra. Okay, which passes through the penis. Okay, so this is the longitudinal section. So here, this is the cross section of the penis. So in this cross section of the penis, you can see there are two structures here. Okay, this is called as corpora cavernosa. Okay, corpora cavernosa. And below this, there is another mass of tissue which is called as corpus spongiosum. Okay, corpus spongiosum. Okay, so and through this corpus spongiosum, the urethra is passing through. Okay, the urethra passes through corpus spongiosum and it opens into the exterior through the external urethral orifice. Okay, it opens into the exterior through the external urethral orifice. Okay, so this is the about the penile urethra. Okay, so three parts of the urethra: prostatic urethra, membranous urethra, and penile urethra. Prostatic is the most dilatable part, membranous is the narrowest part, and the penile urethra is the longest part. Okay, the penile urethra passes through corpus spongiosum. Okay, it passes through corpus spongiosum. Any doubts until now? Okay, now we will go on to the next part of the urethra, which is the female urethra. Okay, the female urethra is short. Okay, you have seen that the male urethra is approximately 20 centimeters. Okay, it's quite long. So, but in females, the urethra is short. Okay, it is just 4 centimeters and it is situated behind the pubic symphysis. Okay, it is situated behind the pubic symphysis. There is no prostate gland in females. Okay, so it passes just below the urinary bladder. It passes behind the pubic symphysis, and it also opens into the external urethral orifice or meatus in front of the vagina. Okay, in front of the vagina. Okay, so here you can see this is the pubic symphysis, the anterior part, the urinary bladder. Okay, the urinary bladder, and this is the internal urethral opening or meatus. This is the external urethral opening or the meatus. Okay, so internal urethral opening, external urethral opening. Okay, and it is situated behind the pubic symphysis. Okay, and it opens in front of the vagina. Okay, so here you can see the vaginal part. So it opens in front of the vagina. Okay, so this is the female urethra. Okay, it doesn't pass through any prostate gland and it is not divided into many parts. Okay, so it is just a small one. Okay, so it is 4 centimeters. Okay, and situated behind the pubic symphysis. Any doubts? All right. So as I said before in my previous class, there are two sphincters. One is internal urethral sphincter and the other one is external urethral sphincter. As I said before, The internal urethral sphincter is involuntary, okay, which is not under our voluntary control. Whereas the external urethral sphincter is under our voluntary control. Where is this internal urethral sphincter? The internal urethral sphincter is located near the bladder neck. Okay, so at the end near the internal urethral meatus. Here you can see this is the internal urethral sphincter at the bladder neck. Whereas the external urethral sphincter is located around the membranous urethra. Okay, around the membranous urethra, both in males as well as in females. Okay, so here you can see the membranous urethra. Okay, so around this membranous urethra there is a sphincter which is called as external urethral sphincter. Okay, so the external urethral sphincter is under voluntary control, that is we can control it, whereas the internal urethral sphincter is not under our voluntary control. So when the urinary bladder is filled up, the internal urethral sphincter will sense it, okay, and then it will send signal to the brain. Okay, then the person realizes he has to go to the washroom, and then once he goes to the washroom, the external urethral sphincter will relax, okay, and the act of micturition occurs. Okay, so this is about the internal and external urethral sphincters. Any doubts? Okay. All right. So now I am just going to take you to some of the cases. Sometimes there will be a few questions which are clinically oriented. Okay. So there will be some clinical based questions. Okay. So how to answer these questions? Okay. So say for example, a 24-year-old man presents to the clinic with loin pain. Okay. Loin pain. What is the meaning of loin pain? It's a back pain, okay, slightly on the upper part. Okay, slightly on the upper part. So what could the problem be? The problem could be due to many reasons. Okay, so it could be because of back pain, okay, the spinal problem, okay, many other conditions. But with respect to the excretory system, where could the problem be? Okay, this problem, because this is the loin is most likely the location for the kidneys, the problem could be in the kidneys. Okay, the problem could be in the kidneys. Why there is a loin pain? Because the kidney and the skin over the loin region, okay, the kidney and the skin over the loin region are supplied by the same nerve. Okay, are supplied by the same nerve. So that's why there is a loin pain. Okay, so if a person comes with a loin pain, okay, so you can think of, there could be many reasons, but you should also think of a kidney problem. Okay, say a kidney stone. Okay, a stone inside the kidneys. Okay, so that could be a problem. Okay, so if there is a loin pain. Okay, the next one. So here you can see a 28-year-old male presents to the emergency clinic with severe colicky pain. Okay, severe pain. Okay, excruciating pain. Okay, radiating from the left loin to the base of the left scrotum. Okay, the pain is from the loin to the scrotum. Okay, so what could this pain be due to? It could be, what is the structure which passes from the kidney until the urinary bladder? It is the ureter. Okay, so this could be a problem in the ureter, a ureteric stone. Okay, so this is the classical presentation for a ureteric stone. Okay, the patient presents to the emergency clinic with severe pain. Colicky pain means restless pain. Okay, some people, if they are having a pain, they will just keep quiet. Okay, in severe pain, they will not move. But colicky pain, it's a severe pain. They keep on moving restlessly. Okay, and it's a severe kind of pain. Okay, and this pain will be present from the loin to the base. The pain radiates from one part to the other part. Okay, along the entire region there will be the pain. Okay, this is called as radiating pain. Okay, from the loin to the scrotum. In females it is from loin to the labia majora. Okay, to the labia majora. Okay, so there will be pain, a radiating pain, and in case of a pain, person presents with this type of pain, think of ureteric stone. Okay, think of ureteric stone. The stone is present in the ureter. When the stone is present in the kidney, there is only back pain, only loin pain. When it is present in the ureter, the pain is severe and it is radiating. Okay, radiating from the loin to the scrotum. So why there is a radiating pain? The same reason. Okay, the skin over this region is supplied by the same nerve as that of ureter. Okay, so that's why there is a radiating pain. Okay, they have the same nerve supply, so that's why there is a radiating pain. Okay, okay, so these are some of the pages. Okay, I would suggest you to go through. Do you have any doubts?
Doctor, do these kinds of questions that we now answered with you, does
Yes.
it enter in the midterm? Like, does these questions come in the midterm? ICA, I guess.